Hi, I'm Dr. Shawn Allen. Welcome to my channel, where I'll be discussing aspects of the nose, sinuses, snoring, sleep apnea, and other conditions that I manage as a fellowship-trained rhinologist or sinus expert. I'm board certified in otolaryngology or ENT surgery, and I've been in practice in Houston and The Woodlands, Texas since 2015. I'm one of two fellowship-trained sinus experts with my Houston surgeons, and we both trained at one of the premier sinus fellowships in the United States. This intro video is intended to help potential patients get to know me and how I might be different from other ENT physicians who treat the same conditions. I also wanted to describe the path to becoming a super specialist in rhinology and the benefits that this brings to patient care. First, I'll tell you a little about myself. I attended college, medical school, and residency training through the University of Tennessee. I then completed a fellowship here in rhinology or endoscopic sinus and skull base surgery at the University of Miami. Including an additional year dedicated to research, my path to becoming a fellowship-trained rhinologist lasted a total of 15 years after high school. I met my wife, who's also a physician, during medical school, and we have 2 children and a dog that keep us busy at home. When I can find the time, I enjoy being creative and have found music, woodworking, and now videography to be fulfilling uses of free time. In addition to educational content, I enjoy creating music parodies and funny skits around the office for social media. My approach to patient care has remained consistent over the years since I first started my practice. Every patient has a story to tell, and I spend the time needed with my patients to understand their problems, the factors that might be contributing to their conditions, and to guide them through a workup and treatment process that is most likely to provide lasting relief. Not every patient needs surgery, and I don't push procedures. Those that need them will recognize this need and pursue interventions when they're able to. Understanding the risks of waiting, the role of medications versus surgical procedures, and any ongoing care needed long-term after surgery allows patients to make the best decisions for their given circumstances. I also make myself accessible so that even years after surgery, patients continue to reach out for help when needed. So why did I spend an extra year in fellowship training after ENT residency? The experiences and opportunities to learn your area of interest during a fellowship far outweigh those opportunities available in the same areas during residency training. There are procedures done in high volumes during residency that any ENT surgeon is likely capable of doing well, such as a septoplasty or a tonsillectomy. Sinus surgery is different in that there are easy cases, but also much more challenging cases that require techniques that are not learned well and certainly not mastered in residency training alone. As a fellow, you become the expert in those challenging cases very quickly because your entire surgery schedule is composed of those cases so challenging that other community ENT surgeons refer them out to the academic center where you're able to work with a world-renowned expert in the field on a daily basis and perform all of those tough surgeries. Tackling hundreds of challenging sinus and skull base cases within a single year fine-tunes a surgery skill set and comfort level with complex surgery that can't be achieved in such a short time otherwise and generally isn't achieved by most ENT surgeons. Within the subspecialty of rhinology, this applies to sinus surgery in a few key areas. Extended sinus procedures are sometimes needed in advanced cases where past surgeries have already failed, or the problem is too significant for the usual sinus approaches to succeed. For example, the frontal sinuses in your forehead are considered the most challenging or risky to open up well, particularly when the anatomy requires drilling or more complex instrumentation. A low-throat procedure, or a frontal drill-out, is used to connect those 2 frontal sinuses with a 2 centimeter wide opening into the nose, which greatly enhances access for scoping those sinuses, clearing polyps or thick mucus when needed, and ensures that a sinus rinse can both clean and deposit medications into the frontal sinuses. Sphenoid sinuses can also be opened widely and connected to facilitate better access and rinses through extended sphenoidotomy procedures. The ethmoid sinuses are composed of layered air cells between the orbits and up to the base of the skull, and attention to detail and familiarity with endoscopic nasal anatomy are essential to addressing ethmoids fully without increasing the risk of injuring vision or causing inadvertent spinal fluid leaks. Other examples include comfort repairing spontaneous spinal fluid leaks within the nose, improving tear drainage by opening up the lacrimal sac within the nose, removing benign or malignant tumors within the nose or sinuses, and assisting endoscopic approaches to intracranial lesions in partnership with neurosurgeons. During my residency training, occasional exposure to these complex procedures sparked an interest that developed into my desire to super specialize and further improve my skill set in endoscopic, sinus, and skull base surgery. My year in rhinology fellowship was well spent, and I'm confident that my patients are getting the absolute best care for their nasal and sinus problems. On a side note, snoring and obstructive sleep apnea are both impacted by abnormal nasal breathing. And over time, I recognized that many of my patients had poorly treated or unrecognized sleep disorders. Correcting their nasal issues often led to improvements in their quality of sleep and in some cases eliminated their snoring. However, not everyone noticed these improvements as sleep disorders are impacted by other factors outside of the nose. Over the last several years, I've incorporated more treatments aimed at improving snoring and sleep apnea into my practice to help this subset of patients. One of the more interesting examples is the Inspire hypoglossal nerve stimulator implant, which helps patients who can't tolerate CPAP therapy achieve safe and restful sleep by moving their tongue forward with each breath, similar to the function of a CPAP machine. Restoring quality sleep is proven just as rewarding as successfully managing sinus and nasal disorders, and these often go hand in hand for many of my patients. I'm now more confident than ever that my practice is well equipped to help anyone in need find relief from sinus problems, restore their nasal airflow, and routinely get restful sleep. Thanks for watching. I'm Dr. Allen with my Houston Surgeons. If you'd like to see me as a patient in Houston or the Woodlands, Texas, please visit my website at premiersinus.com or call my Houston Surgeons at 713-791-0700. Thanks for watching.